challenge with acute burn management is that the entire multidisciplinary team must work together. In the past, different consultants work on different schedules without close coordination. This made close coordination challenging, and any delay would affect a patient's recovery. The team put in place a protocol to introduce best practices while improving the workflow.
Different members of the healthcare teams came together to improve the care of the patient. Significant improvements have been recorded in all areas, including length of stay, time to surgery, number of operations, and even sepsis rates.
This practice has also brought about a successful drop in the mortality rate from a previous 2.7% to 0.5%.
This will mean more of our patients can return home safer and faster.
The consistent rate at which patients were acquiring catheter-associated urinary tract infection was something we were concerned about and decided it had to be dealt with.
Our patients are mostly elderly with similar indications for urinary catheterization. So we focused on that and came up with streamlined processes for the hospital to reduce COTI rates. Through engaging various stakeholders, the team came up with evidence-based practices that were sustainable and accepted by the ground staff. To date, we have performed better than our target results for 12 months and had months with 0 cases.
We'd like to share our experience with other hospitals so more patients can benefit.
When we learned that almost 70% of delayed discharges were avoidable and that we were almost the lowest in next of kin satisfaction rating amongst all community hospitals, we pulled the team together to decisively rectify the issue.
Through surveys and information collected, we identified 3 main NOK personas. We used these personas to develop SOPs. By catering our manner of interaction and outreach to different personas of NOKs, we have been able to ensure that NOKs are well informed and confident in caring for their loved ones. We are able to quickly identify issues that NOKs may have and directly step in to offer help and advice. We are now at 96% NOK satisfaction and are seeing all-time low numbers of avoidable discharge delays. Our character personas are now part and parcel of communication for all staff at Rensi.
Waiting is something patients don't like. Usually patients have to be constantly wait to be warded, to be discharged, to be able to leave the hospital healthy and recover. We see A&E patients waiting for their turn in pain and discomfort all the time, but could do little to ease their problems.
We realized that the physical facility would act as a center that helps to buffer the time needed during the processes involved when a patient is preparing for discharge. This buffer is very much needed, especially when more patients need to be warded.
With the lounge introduced, patients can transfer over after they have been approved for discharge. Nurses are able to streamline and coordinate discharge documents more efficiently while patients enjoy the facilities.
As it stands, waiting time has been reduced by about 20%, and that means more patients are receiving timely help. To have our patients leaving the hospital healthy and happy is all we can ever ask for.